Good afternoon, this is TTT Live and TTT Live online on Facebook. I'm Dike Rostant with a COVID-19 review. Now, following up on the COVID-19 update, the Minister of Health has made it clear that any private lab which is certified must pass on information from tests done on the public to the Ministry of Health. And this morning he made it clear why this protocol is necessary.
Anticipating that a private lab may become certified, but they know they will become certified under these conditions. We don't want to surprise them and surprise the public who may want to take use of them. It's the same way we have been proactive from the very beginning. We want to be very proactive, open and transparent with the private labs so that they understand the conditions under which they will be certified.
And this while the Principal Medical Officer of Health Epidemiology, Naresh Nandram, assured that the new point-of-care machines are in the country, in Tobago to be precise. He says the machines can do more than detecting COVID-19. A little further afield, the best defense against disease outbreaks and other health threats is preparedness. And that's according to Director General of the World Health Organization, Dr. Tedros Ghebreyesus. Now, during the WHO's media conference in Geneva today, he said such a defense includes investing in building strong health systems and primary health care. He added that the COVID-19 pandemic is causing a significant loss of life, disrupting livelihoods, and threatening to undo much of the progress the world has made when it comes to healthcare.
Health systems and health security are two sides of the same coin. If we don't invest in both, we will face not just health consequences, but the social, economic, and political fallout that we are already experiencing in this pandemic.
Dr. Ghebreyesus said during the World Health Assembly next week, the WHO will discuss not only how to defeat COVID-19, but how stronger health systems can be built with health leaders from across the globe.
We have a once-in-a-lifetime opportunity to prove that the world is more than just a collection of individual countries with colorful flags. We're one world that has more in common with each other than we would ever dare to believe.
And the WHO says it has noticed many attacks on not just healthcare providers and workers, but on persons who have recovered from COVID-19 worldwide. Speaking at the organization's media conference, Executive Director of the WHO's emergency program, Dr. Michael Ryan, said in April they've seen more than 35 serious incidents in over 11 countries. They involved attacks on individuals or groups. He described it as senseless acts of violence and discrimination.
It does nonetheless have a huge impact on individual health workers, particularly when we've seen assaults on health workers themselves, because they are health workers dealing with COVID and are perceived to be bringing a risk back to their community. We've seen some assaults on COVID patients themselves, seen as a potential risk in communities.
Now, WHO's Director General, Dr. Tedros Ghebreyesus, said he was shocked and appalled to hear of the attack on the MSF hospital in Afghanistan on Tuesday. It led to the deaths of nurses, mothers, and babies. He said it all occurred while the world celebrated nurses and critical frontline workers.
Civilians and health workers should never be a target. And as my colleague and dear friend Mike Rand said last week, the weaponization of health is not helping anywhere. We need health and peace. We need peace for health and health for peace. And we need it now.
And we are now back to Trinidad and Tobago. It is time for a mental health moment with the representative today from TTAP, the Trinidad and Tobago Association of Psychologists, being Dr. Crystal Jane Veerasamy. And we are going to speak about pregnancy and postpartum depression during this COVID-19 pandemic. Good afternoon, Dr. Veerasamy.
Hi, good afternoon, Dike.
All right, so we want to start.
Hear me?
Yes, we can. We can hear you very well, thank you. We want to start from the ground and build our way up. So we're asking you to define a postpartum depression.
Sure. So postpartum depression is a type of depression that around 11 to 25% of women, new moms, experience. So it's one of many perinatal mental health issues that women can experience after the childbirth. Postpartum depression, it's in fact in Trinidad, Professor Hutchinson, he said that 1 in 4 women in Trinidad could experience postpartum depression. And 2 to 3 weeks after the birth of a baby, post-labor, the chances are higher at 35%. So there's a 35% increase rate of experiencing postpartum depression. Now, can I explain a bit? There's a difference between baby blues and postpartum depression. So most moms, after having a baby, they experience baby blues, which would be like about 2 to 3 weeks after having a baby. And generally, the mom would feel a bit stressed. They would feel a bit irritable. They feel sad. They feel weepy. Now, if it is that this persists beyond 3 weeks, so we're looking at 4 weeks to a year, so 4 weeks to 12 months, this could be postpartum depression, right? And it's similar to depression. So there are many signs and characteristics that you can look at depression, but there are also some specific things with postpartum depression. Do you want me to tell you briefly about it?
Yes, please. Yes, thank you. Go ahead.
Hi. Is it okay?
Yes, please. Go ahead. Tell us.
Hello?
Yes, so I can hear you, but while you giving us this description, I want to know how can this pandemic increase triggers or stresses for expectant or new mothers?
Yeah, sure. So with the pandemic is that there's heightened levels of stress. So one of the factors that affects postpartum depressions is heightened levels of stress. And, you know, with a pandemic itself, it means that mothers are making a lot of decisions, not only about their birth and postpartum experience, but also their social and interaction experience, which is weighing constantly against changing information. So what happens that when a person is stressed, especially moms who are stressed, cortisol is released into the body, and it affects your prefrontal cortex. So therefore, it affects your decision-making capacity, and therefore you can experience emotional fatigue. Right? Another factor that may influence our mothers at this time is the fear of uncertainty. So at each stage of their pregnancy period and postpartum, they're faced with decisions of, you know, do I take my baby to the clinic? Do I go to the hospital? Am I putting myself at risk? Am I putting my baby at risk? So there's a lot of fear and uncertainty with the pandemic that possibly could have an effect on the mental health of women who are pregnant at this time. A huge factor as well that I think, you know, a lot of us experience is that we experience loss with the pandemic. And we've all experienced loss, and mothers in particularly, they experience loss of things that are associated with the baby. So for instance, the loss of baby showers. And for some people, they may even have 2 baby showers, one for friends and family and baby showers at the workplace. And we don't have that. We don't have that interaction in the workplace anymore to have like a workplace baby shower. Other losses might be the loss of the birth experience that they wanted. So maybe that they wanted a normal vaginal delivery, but it may be an emergency C-section. You know, other losses could be things like the loss of support in terms of, you know, maybe that they had planned to have friends, visitors at the hospital and at home, but they no longer have that, or support at home, bringing home the baby, right?
And that brings me to the question in terms of saying you may not have that support circle around you, that support network. What are some of the coping mechanisms that you would ordinarily prescribe to someone, but they may not be applicable during the current stay-at-home measures?
Yeah. So coping mechanisms, it depends on the personality and their coping style, right? So depending on each woman's personality and their coping style, they may have different coping mechanisms. For some, it may be that they need the interaction of friends and family. So they may decide to go for tea or lunch or coffee or something like that, but we don't have that social interaction. For other women, they may be a bit more into fitness and health. So therefore they would have possibly gone to the gym or do physical sports, but again, they would have lost that in terms of a coping mechanism. For others, they may want more a spiritual, more a relaxation period. So probably doing like yoga, going to a yoga studio or religious facilities. So for instance, going to your church or the temple or mosque or something. And again, those are things that, people use as coping mechanisms and they don't have right now.
Now, trying to take care of yourself and being able to say, okay, well, I need to have this time for myself. How can you prioritize self-care when you're dealing for this newborn who is defenseless, who is not able to physical distance?
Yes. I think with, self-care, you said prioritize, and prioritize is a very important word that you use. I think it's about actively making that conscious effort that self-care is important, that looking after your mental health during pregnancy is important. So probably having something like a postpartum recovery plan and incorporating self-care. And again, self-care could take on different forms depending on your personality and what is it that you want for self-care. So for some of self-care things, it could be physical aspects in terms of ensuring that you're eating regularly, sleeping, getting rest when you need it, hygiene, proper hygiene. Self-care could also be like meditation, relaxation techniques, those kind of things.
What do you say to someone who is feeling guilt because they're trying to take that time for themselves because they just, it's necessary, but at the same time they say, okay, well, I'm supposed to be taking care of this child is looking to me. What do you say to that person who's torn that way?
Yeah, I think the first thing that I would do as a therapist is validate that guilt, that they feel guilty for feeling that they're being a bit selfish. But I think I'd want to emphasize that you can't pour from an empty cup. So it's about, if it is that you want to be the best mom that you can be for your baby, it's really about prioritizing yourself, scheduling your day, which is it's hard, but it's doable, right? But scheduling your day and knowing that, for me to be the best mom that I can be for my baby, I need to ensure that my mental health is a priority.
I know we've been speaking to the mothers a great deal. What would you say to fathers or partners in this situation?
Yes. Dike, it's interesting because I came across research that shows that fathers actually experience postpartum depression as well, right? But it's less common. But what I would say is that for partners, it is about being supportive, and maybe that they may be the primary support contact for the mother. And therefore, it is about having that supportive role, asking, what can I do? How can I help? Maybe there are practical things that need to be done. In the first few months, a lot of times it's a mother and the baby bonding. And maybe the father can take on a more practical role in terms of meal prepping, washing, caring for the home in some way.
All right, so we want to thank you so much, Dr. Crystal Jane Virasamy, counseling psychologist, as well as thanking the Trinidad and Tobago Association of Psychologists. I won't give you a number, but you can go onto the website, which is www.psychologytt.org, and there is a raft of numbers for you to call, including a specific number if you are the parent of a newborn. So we thank them for their service, the work that you are doing. And we continue with a look at the effects of COVID-19 in the Caribbean region. The International Labour Organization has forecasted that close to 1.5 million full-time jobs in the Caribbean are expected to be lost during the second quarter of this year due to the impact of COVID-19. The ILO says this employment outlook for the region presents in line with the global pattern, a major drop in the second quarter of 2020 from the last quarter of the previous year. The organization said these latest estimates include only, due to data limitations, the Bahamas, Barbados, Trinidad and Tobago, Cuba, the Dominican Republic, Haiti, Jamaica, Puerto Rico, St. Lucia, St. Vincent and the Grenadines, and the United States Virgin Islands. Governments in Latin America and the Caribbean are being urged to cut passenger taxes on air travel if they wish to be competitive when service is restored. Regional Vice President for the America at the International Air Transport Association, Peter Serda, said the state of the global airline sector, included carrier in the Caribbean, is as bad as one could expect, and the airlines will need government support to resume any form of service.
One of the biggest problems that we've always faced in the Caribbean is a very highly taxed market, and it's always taxed on the airline side, on the passenger, consumer side. And this will be a big challenge for the Caribbean once we leave, once we are able to escape from this crisis. And the reason I say this is for the first several months, people are going to be very hesitant to get on an airplane.
Something to think about and possibly an opportunity for us to rediscover ourselves in the Caribbean. But that is what is trending on COVID-19. Remember, you can join us for live coverage on TTT, Talk City 91.1 FM, Sweet 100.1 FM, Next 99.1 FM, as well as on Facebook at TTT Live Online for all your COVID-19 updates. Thank you for joining us. On behalf of the TTT crew, I'm Dike Rostant.